weekly session of YouTube and Instagram Live. So I hope everybody joins in early and so we can start immediately. So today I will discuss few of the symptoms in relation to skin. Now we had a lot of questions on WhatsApp regarding abscess formation and what to give in abscess. And lot of people have told me that in abscess that we have Hepar sulf or silicia, sulfur. But in abscess there are other medicines also which we have to remember. Yeah, welcome Ria. That are very important in our day-to-day practice. It is not always Hepar sulf, it is not always silicia, or it is not always these remedies, but there are other remedies also very important. Of course, calendula is definitely there. You must remember one remedy which is very important in relation to abscess, abscess formation and pus formation and all. It's a very important remedy. I know you must be knowing that remedy. The remedy is myristica. This is myristica cibifera. Now, whenever you want to prescribe myristica, it is said that it acts more powerful than Hepar sulf or silicia. If you have boric meter medica, it is written in boric meter medica, if I'm not wrong, it acts more powerfully than Hepar sulf or silicia. So if you're thinking of using Hepar sulf or thinking of using silicia and you have never used myristica, that means you have not used the most important remedy, the most powerful remedy in relation to abscess, or it is said in relation to antiseptic effect of homeopathy medicines. Welcome Dr. Komal, Dr. Rashi. Second thing, it is very important to understand when to prescribe myristica. Of course, there are pus symptoms, but I'll tell you one symptom which is very important in myristica, because normally if you have that symptom, you normally prescribe antim crude. Similar to that, myristica has symptom tongue is white and cracked. Cracked tongue normally is nitric acid, as we know. White tongue is antim crude, but in myristica, it is tongue is white and cracked. Very important symptom of myristica. Third, myristica is a very important remedy for carbuncles and also for fistula. Normally if you have fistula, we normally think about common remedies, but if you have never thought of myristica, that means you have missed lots in your practice. Welcome Dr. Kritika, Dr. Alexandra. Yeah, welcome Dr. Alexandra. So carbuncles, fistula, and it is said that it has a very great antiseptic powers. It has a very great antiseptic power. So these are the 4-5 symptoms of myristica that you must think about in relation to suppuration, in relation to pus formation, which I have seen in my practice and I've got good results. So we have Hepar sulf, we have silicia, we have myristica also. There is calendula also. One remedy also that you have to think in your practice, and that's also very important, though it is a common remedy, but in that instance you might have not used that remedy in your practice, and that's a simple remedy, that is phosphorus. If you open your phosphorus, and of course phosphorus has a lot of symptoms of mind and body, though we normally prescribe our mind symptom, but if you see phosphorus skin also, it has a very important role in relation to pus formation, like Hepar sulf has, like silicia has, like myristica has. Next time, don't think about other remedies. First, think about myristica if you get a case of pus and antiseptic property medicine. In phosphorus, it is said that wounds bleed very much. Even one patient had come to me in my OPD, had a simple boil and had a recurrent tendency to boil. Of course, I never thought of phosphorus apart from other medicines, but after he did not give results, after 4 to 5 months, he was better, but it again came back. I just asked the boil and I just told the patient just to scratch the boil how it is. When he scratched the boil, the bleeding started so much, and the patient says, "Aisa hi hota hai" in Hindi. It is basically a small boil also bleeds too much. And that was the entry point of phosphorus, and phosphorus cured that case. So sometimes it happens also, we have some periodized mind and we think about all remedies which are very common, and sometimes we forget remedies. Of course, phosphorus is a very common remedy, but in relation to pus and antiseptic properties I'm telling. So when the wounds bleed very much, even small wound, they heal and break open again and again, again and again. That is phosphorus. That's why it is a very important remedy for ecchymosis, very important remedy for purpuric hemorrhagica and petici. Today only I had a very interesting case and a very good result of a very incurable disease in skin, that is pumpholics. Patient was a child suffering from past 8 to 9 years. Since when she was born, about 1 or 2 years after birth, she developed pumpholics and all eruptions on the body. That pumpholic eruptions was on steroids, but since 6 months she's taking treatment, no eruptions, absolutely skin normal, no antiseptic given, no antibiotics given, no steroids given, and she's doing very well. Only one spot on the leg is left and she's very happy. And of course I give the remedy. I'll discuss when the case is totally cured. So this is basically in relation to skin. Of course, now we have remedies: phosphorus, we have hippocel, we have silicia, we have myristica. So these, of course, Dr. Alexander says a remedy indicated for creamy white discharge. Yeah, but you can add one thing, add one remedy also, that is when the discharges are offensive and the discharges are sticky also, I use myristica. And one remedy also you must think about in your practice, do write down in your notes of Matermedica, and that is gunpowder. Gunpowder, if you have not used and if you have not read in your Matermedica, please go home today and read gunpowder. It's a very, very important remedy in relation to skin. Anybody having some symptom or some known use of gunpowder, if they have used in practice, they can also share, because it's a growing lecture. Every time I cannot say that I have used everything and I have got good results, but gunpowder I have seen very, very good results in relation to skin also. Anybody having any experience of gunpowder? Okay. So before the question, I'll just finish gunpowder if I have got time. Dr. Alexander has wrote something. I'll just see. Yeah, walaikum assalam, Dr. Wasim, Kritika, Homeoshine. Patient with severe eczema and swollen elbow, very hot and painful. It suddenly burst and discharge, thick white discharge. Okay, so you're talking about gunpowder? Yeah, so we'll first do this question. This is gunpowder or something else you want to want? And you can add one more remedy, that is chrysobium, acid chryso. It is said again, a very, very important remedy, chrysobium, acid chryso. And if the symptoms are there where, Dr. Alexander said hot elbow is hot, discharge, eczema hot, you want the remedy or you want basically the remedy you're telling about gunpowder, or it's a case? Just clarify that. So, sir, patient anti-TPO 1300 and patient is asymptomatic. What you suggest? No, see, whenever the anti-TPO enzyme is okay. Yeah, I'll just come back to you. तो वसीम भाई, आपने कहा है कि एंटी टीपीओ, ये तो बहुत सरप्राइजिंग है कि एंटी टीपीओ चेक किया डॉक्टर ने. बहुत डॉक्टर्स सिर्फ थायराइड देखते हैं, T3, T4, TSH हाई रहता है, दवाई हम शुरू करते हैं, एंड फिर जब TSH कम हो जाता है हम बोलते हैं पेशेंट ठीक हो गया. बट इट इज़ वेरी, वेरी गुड दैट यू हैव टेस्टेड दिस एंटी टीपीओ. जैसा जैसा T3 T4 पेशेंट का नॉर्मल आना शुरू होगा, सिम्टोमेटिकली बेटर रहेगा, सेंस ऑफ वेलबींग होगा, ऑटोमेटिकली जो एंटी टीपीओ जो प्रीऑक्सीडेज एंजाइम है ऑटोमेटिक नॉर्मल आना शुरू होगा. सो अगर पेशेंट को इतना हाइट एंटी टीपीओ फिर भी सिम्टम नहीं है, सो इट इज़ नॉट ऑलवेज कि हम वो रूब्रिक ले सीक्रेटिव एंड पेशेंट के सिम्टम नहीं है. बहुत बार ऐसा होता है कि एंटी टीपीओ हाई है और सिम्टम नहीं है, जैसे कि HbA1c है और सिम्टम शुगर के पेशेंट नहीं है, ये होता है. बट हमको ये देखना है कि इसका फिर जब T3, T4, TSH चेक कराते हैं सीधे TSH और हाई नहीं भी तो हमको उसको ट्रीट करना है, बिकॉज जब एंटी टीपीओ हाई होगा तो थायराइड ग्रेजुअली हाइपो पेशेंट जाएंगे हाइपोथायराइडिज्म के अंदर, और ये होने के पहले अगर बॉडी को आप दवाई दे देंगे तो एंटी टीपीओ नॉर्मल हो जाएगा पेशेंट का. टेक द फुल केस, क्योंकि ऑटोइम्यून डिसऑर्डर में आता है, एंड हिस्ट्री जाने के बाद हम उसको डिस्क्राइब करेंगे आपसे. अगर आप पूरा हिस्ट्री हमको बोलते हैं तो विल टेक द हिस्ट्री, विल टेक नोट ऑफ द सिम्टम, व्हाट टू प्रिस्क्राइब, एंड देन वी कैन क्योर द केस. नो the patient with severe eczema, hot, swollen, very hot, pain in suddenly burst and discharge, thick and yeah. So whenever you get case, if this type of symptom and the patient discharge is there, suddenly is there, hot is there, there are few remedies which are very, very close to this. And the first remedy you must think about is syphilinum, Second is sorinum. In this, we have seen lot of good results with this type of cases. In acute, if you want to prescribe in these cases, you can prescribe calendula in LM potency start with 0/7. ओके तो अगर उसका थायराइड T3 T4 नॉर्मल है, फिर भी अगर ऑटोइम्यून डिसऑर्डर्स है, मे बी ये प्रकार के पेशेंट, जो मेरा एक्सपीरियंस है वसीम भाई, ये प्रकार के पेशेंट बहुत समझदार रहते हैं, बचपन से बहुत प्रिकॉशियस रहते हैं, डिलीजेंट रहते हैं, खुद अपना काम करते हैं, दूसरों भी का भी काम करते हैं, तकलीफ अपने ही से खुद ही सहन करते हैं, किसी को बताते नहीं है, जो भी है वो उनको लगता है कि ये तो मुझे ही करना है, और ये कंडीशन में क्या सब चीज़ दबा के रखते हैं वो, और ये कंडीशन के अंदर हमारा हार्मोनल इम्बैलेंस, एंडोक्राइन पूरा इम्बैलेंस हो जाता है, और ये पेशेंट के अंदर फिर हमने देखा गया कि इनके T3 आगे जाके इनके टाइम टी जैसे बताया अपना हाई है, उसी प्रकार से इनको शुगर भी हो जाता है। बोलते कल तक तो मैं बिल्कुल ठीक था, लेकिन HbA1c कराया तो 14 निकला हमारा, और फिर हम ट्रीटमेंट शुरू करते हैं। इन्हीं पेशेंट को फिर BP होना शुरू, सडनली पता पड़ता है BP 180 और 120 आ गया। सो ये सब हम सप्रेस नहीं बोल सकते, समझदार पेशेंट या सप्रेस पेशेंट भी हो सकते हैं। तो इनका सोरा में जाके देखिए बेसिकली किस प्रकार की इन लोग पर्सनैलिटीज है, ऑटोमेटिकली आपको इनके सिफिलिटिक सिम्टम मिल जाएंगे। ओके, बट शी इज ऑन फेरमफॉस। अच्छा, this is the case which I told you about Ferromphos 1m and sulfur LM3. Okay, no, that was the case where you told that you had given everything, it did not work. So in this case, yeah, Ferromphos 1m first day I told you in given water, okay, and sulfur LM3. Yes, that's fine. You can continue. I thought it was a case where yeah, so it was a case LM3 twice a day, Ferromphos 6x, yes, and 1m. Very nice. Continue that. Ferromphos in water. Okay. So I thought it was a different case. So yeah, a lot of good hearts. Thank you for that. And okay. So again, and do give me the result in the next webinar. So that I can know that we have prescribed it right. Though, when there is a paucity of symptoms, I basically try to use the experience what I have and whatever cases I have cured, and then try to get the remedy if I don't get the whole case. So if do share the whole case if the patient is better. Next thing in skin, I hope you understood something about that abscess formation in skin and all. So you do use these remedies and with good result. Of course, if you open the repertory, there are so many remedies, and I have not used so many remedies. The basic remedies which I have used in my practice, I'm just sharing you that so that it's easy for you to understand. Now, one more question was there on on my WhatsApp, that remedy for ecchymosis. Generally it was a case. Generally we feel that when there is old age problem, when a father, grandfather, they pass 75, 80, there are black spots on the skin and there is ecchymosis. So normally it is seen that most of the patient use arnica. Yeah, arnica is definitely a very, very important remedy. I'll just discuss one case, of fever, where the case of fever was there and the patient had ecchymosis during fever. We repertorized the case. I had 2-3 symptoms, and in that I did not give arnica. I gave arsenic album, and the case beautifully was cured with a single dose of arsenic. So ecchymosis during fever. In general, if you have seen ecchymosis, ecchymosis, arnica is definitely there. But I would like to tell you that also think about case remedy like ledum pal and sulfuric acid. Very, very important remedies, very, very good results in this remedy. Of course, if the symptom correspond. If you have attended my dengue fever, webinar, I had a lot of cases of dengue fever which I have cured without hospitalization. On the first day, the patient came to treatment, and with homeopathy, without hospitalization, without the platelet count dropping, the patient was cured. So otherwise, what we tell to a patient, you came late, otherwise I would have cured you the homeopathy. Now the patient comes to us. With first homeopathy, and they say, now you treat. So it becomes very, very important to understand. So for ecchymosis, of arnica is definitely there. Think about ledum pal, think about sulfuric acid, think about, I think, phosphoric acid also. Okay, so these are the remedies. I use gunpowder and bed sore on paralyzed patient. Yes, very nice. There are wide varieties of use of gunpowder. I just told you one symptom, and if you open Mater Medica of gunpowder, and there are so many cases, of gunpowder with good results with bed sores and all. But in bed sores, one thing I have seen very, very Wasim bhai, कि जब बेड सोर होता है ना, वो बास कैसी आती है? बास कैसी आती है? फर्स्ट, बेड सोर के आजू बाजू का जो अल्सर रहता है वो कैसा रहता है? बहुत शार्प मार्जिन रहते हैं, बहुत डफी मार्जिन रहते हैं, बहुत सर्कल रहता है, वो देखने का। एंड डिस्चार्ज कैसे है? एक्रिड है, व्हाट यू कॉल एक्रिड है, ब्लेंड है, कैसी बास आ रही? और उस पे से भी क्या रहता है कि हम रेमेडी सेलेक्ट कर सकते हैं। गन पाउडर, कैलेंडुलस, इचनीश, ये सब रेमेडी लोग यूज़ करते हैं ड्रेसिंग के लिए, और वो बहुत अच्छा रिजल्ट आता है। ओके, सो गन पाउडर एक ऑल्सो है। एक अगर आप देखेंगे मैथमेटिक्स में लिखा हुआ है कि लैकेसिस एंड ऑल अदर रेमेडी when failed to work in ulcers, gunpowder 3x cured the case. ये एक बहुत इंपॉर्टेंट चीज है जो गन पाउडर में लिखी गई है। जिसे माइलेस्टिका में आज मैंने बताया, अब देखेंगे बोरिक मेटरमेडिका, इट हैज मोर पावरफुल एक्शन देन हिपारसल फॉर सिलिशिया। दिस इज वेरी इंपॉर्टेंट। Yes, blackness. Yeah, basically gunpowder, if you see the literal sense of using gunpowder, whenever there is, poisoned with severe gas, blackish discoloration, gunpowder use. But if at all I am using for skin and ulceration, I basically see the discharge. How is the discharge? How is the color of skin? And how are the borders and margins? That is very, very important. Okay. Dr. Rehana, welcome. Increased pus cells plus diabetes plus burning maturation. Increased pus cells plus diabetic plus burning maturation. There was a chart. There was a chart on which was going very well in the WhatsApp. This burning this remedy, this remedy. But I just want to ask you, whether have you seen these type of charts working in your practice and diabetes getting cured? That's one symptom. And second thing, with diabetes, if you prescribe only on charts and symptoms, is diabetes going to get cured? That's also something very important to understand. Increased plus cells plus diabetic plus burning urination. Two remedies that I have seen very well in my practice. First is terebinthina, TNT. Do think about Merck cyanide and Uaursi. Very, very important, very, very important remedy in these type of conditions. But if you see diabetes normally would land up in burning maturation because of infection. Diabetes would land up because of infection. There is pus cells. So in this type of cases, make sure that diabetes is taken under control with the constitutional medicines rather than prescribing for these type of symptoms. But if you get these type of pus cells and burning and diabetic, think about these 4 or 5 remedies. Of course, then phosphorus, phosphoric acid, and cantharase, and these remedies are there. But these remedies I have found very, very useful in my practice. Asha Patel, welcome. Dr. Shweta Laddu, welcome. So this was something about pus. Today there were a lot of cases of pus, because of late I am getting a lot of cases of diabetes, and by the grace of God and by the grace of homeopathy, they are doing well with homeopathy medicines. In fact, if you have seen, with gunpowder, there are some symptoms of gunpowder which are very, very important that you have to think about. Of course, blackness is a very, very important symptom. And it is said that when lachesis also fails and other remedies of pus fails, gunpowder becomes a very, very important remedy. Second. And third, gunpowder is a very, very important, in broad I am telling you, a very, very important remedy for blood poisoning. Blood poisoning. Now, if you see blood poisoning, just a minute, Dr. Desha, it includes where the body is in a state of septicemia, when lot of antibiotics have been given and the patient starts going into organ failure. And doctor says, now we have given all the antibiotics, but nothing is working. My dear friends, if you use gunpowder, I have cases where ICU I'm treating and I've given gunpowder with tremendous result. Only one symptom use of gunpowder, that is blood poisoning. I was not going to tell you because normally people expect me to tell something very common of a remedy. That's why I basically start telling common symptoms, because a lot of people say that whatever I say, they don't get cases and then they don't get results. So I'm just telling you a common symptom of gunpowder. But if you get a case from a ICU, septicemia, generalized infection, doctor says we have done everything, nothing is working. My dear friends, try to use gunpowder. Gunpowder will give you fantastic results. Septicemic cases. Remember one word for gunpowder, that is blood poisoning. And blood poisoning has varieties of indications and varieties of symptoms and varieties of application. So remember this word blood poisoning, and you will really enjoy the use of gunpowder with different diseases also. Okay. Welcome, Dr. Aisha. Welcome, Dr. I think Navjot. Disha, how to start the case of PCOD? PCOD, as the name suggests, polycystic ovarian disease. Now, see, whenever your ovaries are becoming like cyst, that means the ovum is not rupturing at a particular centimeter, 18 to 22 centimeter, it is becoming into cyst. That means the growth process, the hormonal process is disturbed. Find out where it was disturbed the most. In the hormonal cycle of a lady, you make sure that what was the first instant when the patient had a problem of menses, because that relates to symptom relation to endocrine system. Of course it can have lot of repercussions at any age, but if you want to pinpoint, just ask कि कब आपका पीरियड लेट हुआ था डॉक्टर साहब? जब भी मैं 12th में थी ना, बहुत स्ट्रेस था, तब 2-4 बार मेरा पीरियड स्किप हुआ था, फिर नॉर्मल हो गया. That means that was a time where the body just went away from normal, but came back to normal because the constitution was strong enough to fight back. Ask what was that which created that partial shift and back to that. But every time the body cannot come back automatically, then it requires the medicine. So this is one of the entry points of the lot of entry points. So do this and then start the treatment. For me, it is constitutional treatment mainly related to mind. So help me for 2 cases. One is plantar psoriasis with violent itching ends in bleeding. Okay, see, as I have told you, Dr. Patel, psoriasis is basically a disease of the mind expressed in the body. And I have taken a lot of webinars, Instagram live. If you have seen my Instagram live on psoriasis, I have just done everything in psoriasis. But symptomatically, if you want to know that what medicine should be given, take the whole case. Okay. Secondly, as I always told you, I'll just give the remedies also, so that you also understand which remedy comes in your symptomatically. You can think about Ars iode, you can think about Ars brom, you can think about calcarea fluor, you can think about petroleum. But I would suggest do take the case, because if the hands are cut, the patient even cannot fold the hands and fingers. It is so painful. And first tell the patient, if it's a lady, don't use detergent, don't use soap, don't cut these vegetables in your kitchen, because that also can aggravate, maintain the psoriasis. Avanti, welcome. Skin eruption right side and then appeared on left side, same place. All complaints are symmetrical. Yeah, you can take that symptom, Dr. Kishan. Symmetrical complaints, but only on that symptom, if you want to prescribe, then you have only few remedies to think about. Symmetrical complaints. You have arnica, you have syphilinum, you have thyroidinum. I think there is kaliad also. But as I always tell you, if it is showing on skin, it has to, if that symptom defines the whole personality, then take that symptom. Okay. So you ask in Sora, in psychosis, whenever he gets a complaint, is simple from from discharge from the nose, every time both nose, itching every time both sides symmetrical. So if that symptom is there in Sora, psychosis and syphilis, if that symptom is present in patient constitution more 3-4 conditions, then you can take this symptom of symmetrical complaints and then prescribe. If it is one-sided and it is classically showing, then also you can take the symptom. But I would definitely ask, try to define the symptom in the whole constitution. That is very important. Welcome, Dr. Komal. Piles protruding after bleeding, but has lot of burning and after stools. Yeah, whenever there is burning after stools, I'll just tell you the remedies which are very common. Dr. Yeah. I can't get your name. So I'll just tell you the remedies which are very common, and then we can go to uncommon remedies. The most common remedies, the most common remedy if you have used in your practice, and that is Retania. We get good results with Retania, and it is of course symptomatically the patient will be better. If I have not tell you one remedy, it is Sedum Arc, SEDUM ARC. Again, a very important remedy. And that in acute will give you very good results. Third, you can think about, of course, the sulfur is always there because it is burning and all. Fourth, you must always think about one remedy that is also I have seen in my practice having good result, that is allosocretina. So these 4 5 remedies, then of course you have one remedy, of course this is also very commonly prescribed and you should also give, but in that burning and there is pain is also there, and then that is peonia, Paeon. So these are the remedies you can think about apart from the huge repertorial collection we have in our repertory. Thank you. Which potency to give gunpowder in, and where can we read more gunpowder? Whatever I have read in gunpowder, I have read gunpowder from Clark Mathematical. Okay, you can use any book, but for me I always use the basic books because they have done extensive proving and extensive they have written. So I use Clark Mathematical for gunpowder. One cases of impotency, whole case looks like selenium, but don't get any result in 1 month. If you think that the whole case is of selenium, so I think you wait for 15 days and think about then changing the remedy. Don't change the remedy immediately, or you can increase the potency or use LM potency before changing the remedy. If you are very sure that you have got selenium, then I would suggest don't change the remedy, wait for at least 15 days, then increase the potency, especially if you have LM potency very well. It works fantastically because in these type of cases we require that. In selenium, one or two symptoms that you must think about, which is very important to know. A selenium patient cannot work because of sexual excess or after sexual excess. Very important. Second, in selenium there is always confusion after emission. Second, very important symptom of selenium. Third symptom you must always remember in selenium, a selenium patient has aversion to company from his most intimate friends. मतलब जिससे बहुत ज़्यादा फ्रेंडशिप है, फिर selenium को पसंद आना बंद हो जाता है. Selenium, ferrum metallicum, nitrum carbon, I think iodine is there. So these 4 or 5 symptoms of selenium are very important. Welcome Dr. Wadekar, Dr. Dhirendra. PCOD if a girl has irregular periods from menarche, how? That's a very good case, and that becomes very easy to prescribe, Dr. Disha. You have to go beyond that. Ask how is the relationship of child with parent, mother, education, teacher, and friends. A child is most affected by the parents, discord between the parents not getting along very well, or their parents not taking care of the child properly. Parents have no time, or the child is bullied at the class, child does not have good marks, especially children of doctors, chartered accountants, all professionals, I would say, not labeling anybody. They don't give time and the child feels very alone and all, and that's why the first challenge of life is menarche, and that is disturbed. So that becomes an easy case. Dr. Abbas, welcome. One case of I hope you got that right. Okay, hello Dr. Babel. So I think if you get the answers right, and if you get just give me a thumbs up and hearts in Instagram, so I know that I'm able to convey whatever I wanted to convey. Okay. Yeah, I hope Dr. Disha, Mayur, Kishore, you got some answers about your questions. Okay. Whatever I can remember extempore, it's very fast on this live. You can't think and you can't look anywhere. So that's why it's very important for me to know that you are understanding what I want to tell you. That's important for me. Of course, so don't change selenium so fast. PCOD. Okay, so I think next webinar of my is starting from 11th of December, 11, 12, 13, 14, where I am basically taking LM potency with cases. So I'll add a case of PCOD, and I'll try to explain everything. Try to explain something about PCOD, what you have to look for PCOD, and then how I prescribe the medicine and how the patient got cured. So I'll take a case of PCOD in my next Zoom 11, 12, 13, 14 December, LM potency with cases, and I'll add a case of PCOD so that I'll be able to explain slowly and according to my time, so that I don't have to rush. One thing also, Dr. Patel, if your selenium is right, एक सिलीनियम पेशेंट बहुत इंपॉर्टेंट है, आप समझ लीजिए। हमने देखा होगा बहुत बार बच्चे बातें करते हैं, बच्चे हंसते हैं, बड़े भी मतलब बड़े भी हंसते हैं, बात करते हैं। ये सिलीनियम पेशेंट पता है क्या करता है? ये सिलीनियम पेशेंट रात को कैलकुलेशन करता है। वो कैलकुलेशन करता है 30 40, उसको 4 5 60 70। ही इज इन स्लीप ही डज कैलकुलेशन। In sleep is just calculation, that is selenium. A very, very important symptom, whatever cases I have seen selenium, this symptom when I get this symptom, I first think about selenium. It is not specific, but I first think about selenium. Okay, so write this in your mathematics also. Yeah, so Dr. Priyanka Lakshmi, welcome. So I hope you got something about selenium, Dr. Patel. That's a very important symptom. So I think it's already 30 minutes and we are through with that. I would like you to all join my Zoom. It's a paid version on LM potency with cases. We finished the November series and now we are doing December series, 11th, 12th, 13th and 14th of December. Zoom between 3 to 4 p.m. This time only. It will be interesting if more people join so that we can discuss whatever we want to ask. Okay, thank you so much. Thank you for joining, and I hope you enjoyed as much as I enjoyed sharing my knowledge with you. Until next Saturday, bye.